I'm Dr. Marissa Bennett, and I'm one of the veterinarians here in the Valley Division.
And I'm Brooke, the receptionist here in the Valley Division.
Today we're going to be going over dental basics with you.
And I'll be asking Dr. Bennett some of the common questions our clients have about their horse's teeth.
So here we have the cheek teeth made up of premolars and molars, and these are the teeth that are used for chewing and grinding up the food that horses are going to be eating.
So what is the difference between wolf teeth and canines?
So we have the canines here, and these are much bigger than the wolf teeth, and we've got one wolf tooth here. You can see how small the wolf teeth are, and they're pressed right up against this big premolar back here. The wolf teeth are the ones that we sometimes recommend removing because they can interfere with the bit in the horse's mouth. Canines we do not remove. You can see how much bigger they are. That would be a lot more work to get them out, and they don't interfere with the bit at all since the bit sits here in this space. Wolf teeth can be seen in both colts and fillies. Usually we see them on the top, but we can see up to 4 of them, so they can be down here on the bottom as well. Canines are mostly seen in geldings and stallions, but they can be seen in mares sometimes. Mares usually only have 1 or 2 if they're going to have canines in their teeth.
Why do horses need to have their teeth checked so often?
So looking at the horse's conformation in their teeth, you can see that the upper arcades sit slightly wider than the lower arcades, and because their dental conformation is like this, they're going to commonly get sharp points on the outside of their upper cheek teeth and on the inside of their lower cheek teeth. If this isn't periodically corrected, these sharp points can get so prominent that they'll develop ulcers on the inside of the cheek, up here with the top cheek teeth, and on the sides of their tongue, caused by the points on the lower cheek teeth.
How often should a horse have his teeth checked?
We recommend that horses have their teeth checked yearly, mostly because we're checking for these sharp points that can occur very rapidly. Especially in younger horses, their teeth tend to be a lot softer, and because of that, they develop much sharper points quicker. So in all of our yearly oral checks, we're checking for sharp points, any other dental abnormalities that I'm going to go over later, and then also looking for any ulceration in the soft tissue structures, and looking for any possible foreign bodies that can easily be missed. So the most common abnormality that we see during our dentals are hooks, and you can see we have a couple of great examples of that in this skull. So a common place that we see hook is in the front, the very first premolar in the upper arcades, and that's because this tooth hangs out just a little bit further forward than this bottom premolar, and because of that, a hook will start to develop because there's nothing rubbing against it and filing it down. Just the opposite, in the bottom cheek teeth, we find a hook in the very back molar on the bottom, and for the same exact reason, this comes a little bit farther back than the top molar back here, so this develops into a hook. And these are really important that we correct them each time that we're in the horse's mouth.
What happens if the hooks are not corrected?
So the way that horses grind their teeth is they chew actually in a circular motion. If you've ever seen a cow chew, pretty similar to that. So they need not just up and down motion and front and back, but they need a circular way to chew their hay. And if we've got these hooks in the back and the front, as you can imagine, that's going to really limit how much range of motion they have in order to chew their hay correctly. Some other abnormalities that we see when we look in a horse's mouth are a wave mouth, and this is a great example of what a wave mouth can look like. And this usually occurs in older horses, but it can occur in younger ones as well. Wave mouths occur when either there hasn't been regular dentistry work or when there are teeth that we're getting towards the end of their life and they're becoming shorter. And because they're becoming shorter, as you can see, the opposing tooth becomes longer to try to meet that shorter tooth. If this isn't corrected, just like the hooks, it's going to reduce the range of motion that they have when grinding their food. Another more severe abnormality that can happen, which we do not have example of here in this skull, but I'll try to explain to you. As you can imagine, as horses get older, they start to lose their molars. So you know, this one looks pretty short. We're coming towards the end of its life. When this molar comes out and there's a big empty space here, you can imagine how much higher this tooth can grow. And it won't necessarily be a gradual wave anymore, but it's going to become a step, is what we call it. And that's going to reduce their range of motion even more than the hooks or the wave can, because it's a big jutted out tooth that's going to prevent them from moving their jaw the way that they're supposed to. These are really important to stay on top of because we can only grind so much tooth away in one dental session. So it's important. Another reason why it's important for us to be checking horses' teeth yearly to check for these changes.
Do you ever see those common problems in younger horses?
Occasionally, usually steps is most likely an older horse problem because it's usually due to a missing molar. These wave mounts we can see in younger horses. I'd say it's usually when horses have not had proper dental care in their first few years of life. Things have gotten a little out of control and haven't been correctly floated down into a nice smooth plane, so we get some of these waves. So hopefully this talk has helped you visualize a little bit better what we as veterinarians are trying to explain to you when we're doing your horse's dentals. Just remember that a routine float doesn't necessarily mean that your horse doesn't need floats. It just means that we're only seeing the sharp points that I talked about earlier in the talk. And this will give you a little bit better idea of what we're describing when we say that we see a wave mouth in your horse, or if we're correcting hooks in the back of the mouth or in the front that are reducing jaw movement.